So we're going to have Julio speak again about road infrastructure safety in Jamaica. And Julio is the director of the Latin American Caribbean International Road Assessment Program. Julio?
Okay, so yesterday I presented this application that you can download in a tablet or in a phone, in a smartphone, and this application is intended to be used in a school environment. But I also said yesterday that this application is part of our urban work. But in general, IRAP has been working for a decade assessing roads in order to propose countermeasures to make this infrastructure safer. So I'm going to talk about IRAP around the world, who we are, what we do, and also about policy leadership, which is very important for Jamaica and every country, and also a partnership for success. So look at this, this slide. This is the development of IRAP as a program since 2004 to 2016. We started very, yes, a pointer. So as I said before, we started small back in 2004, and there's a steadily going up, and now we have been present in more than 80 countries around the world using our technology, using our tools, and also the number of kilometers that we have assessed is reaching the million. So we are the international organization which has the largest number of kilometers assessed around the world regarding road safety. How we do this? We do this with partnerships. So we work with governments and we work with universities, NGOs, institutions to make partnerships to apply the technology that we provide for each country. So here you can see, for example, the work of AUSRAP in Australia. India RAP has been assessing a number of kilometers in the country. EuroRAP, this is just part of the program. In Mexico, we have assessed more than 40,000 kilometers in the whole country so far. In the US, etc. So we do this, and the level of investment that comes after the evaluation is really big. So IRAP is also a methodology for providing policy targets, and this is really important because you can have with our tools an objective tool to set policy targets in the countries. For example, in Netherlands, they have set the target of no 1 or 2 star roads by 2020. They just want to eliminate the 1 and 2 star roads. United Kingdom, 90% of travel on 3 star or better roads by 2020. New Zealand, target for 4 star roads of national significance. Safety Alliance to upgrade existing roads to 3 star or better standards. In Malaysia, in Australia, in Chile, the Autopista Central toll roads assessed and immediately upgraded to minimum 3 star standards. So the tools are not only a technology that allows you to know exactly how to improve the safety, but also to set up policies. And you can say, okay, in Jamaica, by year 2020, I want, for example, X% of the road minimum 3 star. So we work with international institutions such as the World Bank, the Asian Development Bank, here the Caribbean Development Bank. I'm going to show a couple of examples of what we do with them. And this allows us to continue with our program. So for example, this is an example of a road in Australia. So you can see that the road in one part was 4 and 5 stars, but also it has some stretch that it was really unsafe. So, by the way, the name of the road was the Bruce Highway. So they improved the conditions of the road based upon our countermeasures. And look at this figure. In 2012, 53 people died in crashes on Bruce Highway. In 2014, the figure was down to 17. So this is only one example. I'm going to show a better example now of a country very, very near to this one that demonstrates that in the safe system, not only the user is responsible, but also the infrastructure. So the infrastructure plays a key role in road safety. Look at this. I was personally part of this project. This is Belize, a country not very far from here, English-speaking, small, in the Caribbean. So you can say that it's a reality similar. In 2009, these are figures from the government, by the way. In 2009, 70 people died on Belize roads, nationwide, 70. From the 70, 33, which is 47%, died only on one corridor, which is called the Western Highway. So from the 70, half of them on one corridor. We assessed that corridor. I was part of this project. This is the launch. Here I am with the team of the people. We assessed the corridor. They implemented the package of countermeasures, and look at the change. In 2013, so 4 years later, the number of people dying on crashes went up in the country. So more people died. However, look at the corridor, from 33 to 8. So while in the whole country, no countermeasures, nothing was done, the people continue dying. Look at the next year. Oh, sorry, it's an 80-something, 84, I think that it is here. Look at them, 87, 86, and look at the corridor, 8, 9, 6, 7, and this is figures to August 2017. So the big question here is the infrastructure important or is not? From my point of view, it is. Is it the only thing that we can do in a country? No. We have talked about the safe system. So you have to have, yesterday some presentation said the 3 E's, you remember? Enforcement, education, which is behavior, pretty much, and infrastructure. So when you have the 3 things acting together at the same time, you can have this kind of results. This year, with the money of the Caribbean Development Bank, we are going to assess the other part of the country, another highway, and we expect similar results. This, by the way, was part of a paper that we published, and it was part of the PRC global meeting. So, in Malaysia, for example, a very country far away from here, but also we have partnerships, and we have assessed the country. So these are just examples to demonstrate how we are working. In the UK, we had a number of roads that were just 1 and 2 star, like this one. Again, countermeasures were proposed. They applied the countermeasures. So here's the package. This is all in the IRAP software that you can access online with a password. And after they implemented the package of countermeasures, for example, this is only one, road safe barriers, passenger side, the distance, etc. You have the package of countermeasures there, and the road changed immediately to a better condition. China, one of the largest, or the largest country in the world, 65,000 kilometers of roads upgraded by the end of 2017 as part of the Highway Safety Cherished Life initiative. Star rating and investment plans in 150,000 kilometers across 12 provinces. 5 years investment of 12 billion yuans in China. in safety countermeasures, etc., etc. So countries that are taking and adopting the methodology to do benchmarking and to objectively measure the level of safety of the infrastructure. So in Jamaica, just picturing what could be done in this country, we need champions here. We need leaders. I think that in this room there are many of the ones that could run an IRAP program. So we need a program leader, a person that is going to be leading, right, like the pathfinder that is going to be leading the way. A road upgrade management lead. So these are the people that are going to be implementing part of the countermeasures or all the countermeasures, depending on the level of investment. A technical governance, we provide the training, and the technology is free. The countries don't have to pay for the software. The software is always online. You can access to it via a password, and it's never going to finish. So we need a technical governance. And also, this is very important, stakeholder communications lead, because we need to show this, right? We need to trumpet our success. And also the politicians, especially for them, it's very, very important to cut the ribbon and to say, you know, that was my political will, my political support, and because of that, now we have attained this success, such as the Belize one. So, if I was a Jamaican and I should lead this project, first of all, we need to target the high-risk roads. We don't have to work on all the roads. You saw the Belize example. No, they said, okay, here, 50% of the people are dying on this road. We are going to focus on this one. We are not going to waste the money on the whole country. So for Jamaica, yeah, the data that I saw yesterday on a report there is first level data. So we can take this data, analyze this data, and focus our efforts just on, I don't know, 200, 300, 100, 500, I don't know. But this is an analysis that we have to do and focus on the high-risk roads. Second, to raise the safety on new construction. So we cannot allow the new roads and the new infrastructure be built as it was built before with under unsafe standards. So we need to raise and change, right, to change our mind in terms of making the new infrastructure safer. Third, pathfinders leading the way. There are a number of people here that are very enthusiastic, technically competent, and they want to work in this type of projects. We are not going to invent the wheel. We've done this so many times, and as I said before, I showed examples in China, Australia, and in Belize. So in every country, we can do this. Benchmarking. Why is important benchmarking? Because you can have in 5 years period the same graph that I showed for Belize. So you can say, look, in 2017, we were standing here. Look at in 2022, 5 years later. This is what we have achieved. If you don't have a tool, how you are going to compare the safety? The only way that you can compare the safety is measuring the dead people. You don't have another option. It's just, you can say, in 2017, X number of people died on the roads. In 2022, X people are dying on the roads. But why is that? Maybe it's because the gasoline is higher, the price, and people are using less the cars. You have no idea. So you need to have an objective tool. And this is what this technology provides, to do benchmarking and celebrate the success. Local research and knowledge. This is also very important because with the data that is already here, we need to analyze this data and hash it out in order to see exactly where we are going to focus the efforts. So coordination, we have a number of other countries and other institutions that are working with our tools. So a country or a government or an institution that starts working with this technology, they are not working alone. So we have a number of resources to take advantage of other people that are doing the same work. So, as I said before, aim for all new roads to be built minimum 3, 4, or 5-star standard for all road users. This is also an important concept. Sometimes in countries or institutions, they say, oh, no, I want to get to 5-star. It's not necessary. So you don't need to have a 5-star. Even in the UK, the roads are not all of them 5 stars. Or in Sweden, which is the country that has attained the best success. Their roads are not 5-star. But minimum 3-star, a minimum standard. This is what we need. So build local capacity and ownership. Ownership for us is very important. We are not a company. We are not a consultant. We are a not-for-profit institution. And what we do, we enable others to do the work. We train people, and we allow these people to do their work using our tools. And we receive the funding to improve the tools, such as the application that I showed yesterday. This is an improvement, and now, again, we are putting it for free. So build your road assessment program, engage local partners, develop local capacity, target assessments, upgrade roads, measure and celebrate the success. It's not more difficult than this. So share your knowledge, experience and ideas with your IRAP colleagues and partners around the world. As I said before, there are more than 80 countries that have worked with these tools, and all of them are exchanging best practices and experiences and ways to do the work better. So, for example, something like this can be attainable. Set a star rating policy targets for existing roads, the roads that are now in operation. X percentage of travel on 3-star or better roads for all road users by 2030, or by 2020, or by 2025, whatever. But it's important to set up a goal, right? And start working today to this goal. If we don't have a goal, we are like a blind person, right? We don't know very well how we are advancing. So we need to have a goal. Set minimum star rating standard for new roads. As I said before, okay, the roads that were built, they are already there, and we are going to improve them. But the new ones, they have to have standards. And you can do star ratings on the design, not only on the existing roads. So this is also an important thing. As I showed in the example of the Caribbean Development Bank in Belize, when you have a tool that is objectively showing that you can do an improvement, the finance comes without a lot of effort. So this is not, we are not talking about big money. Remember that all the engineering countermeasures that IRA proposes are low-cost engineering countermeasures. We have a package of 95 countermeasures standards that are being triggered every 100 meters. But this is another presentation. If we work together, I can explain exactly how this, the whole system works. So the policy metric drives investment immediately, and the business case for Treasury. So you can say to the Treasury, okay, if you invest here $100, in the next 10 years, we are going to receive not 100, 500. So how we are going to receive 500? In reduction of debts, because the debts, they have a cost, right? So if you reduce the number of deaths and the serious injuries, you are going to receive more money than what it was investment. This is called the benefit cost ratio. So IRA works with programs that have a benefit cost ratio equal or more than 1 in every single investment. So you can optimize the investment to save lives, and this is an idea, I don't know, development bank finance. As I said before, we work with pretty much every single international institution including the Caribbean Development Bank. That's it. Thank you.
One of the great things about conferences like this is that we get people who have tremendous expertise and who have experience working across the world to come and share with us. I mean, that is a fantastic presentation, Julio. Really want to thank you. Just reinforcing the importance of some of the things that you raised. In fact, while you're speaking and towards the end, an idea came into my head. And I'm going to put somebody on the spot. That's somebody's MP, Michael Phillips. David Ward, who works with another arm of the FIA Foundation, NCAP, New Car Assessment Program, invited and legislator to London for a meeting which was held last week to meet with British MPs to discuss road safety across the world. I think we need a MP, and it's best done in opposition. When you're a minister, you have too many responsibilities. If we can start a group within the Jamaican Parliament, led by you as opposition spokesman on transport, a group of parliamentarians who will meet regularly, who will meet among themselves, who will meet with organizations like ourselves and others to help to promote road safety within the parliament and within the country. I think it will make a big difference. Based on the kind of presentation that Julio just made, in terms of making sure that simple things can be done easily. And if you keep this on the agenda, on the front burner, not on the back burner, on the headlines, not on the sports page, then, or the entertainment page, then I think we can continue to deepen the culture of road safety in this country and make some moves. I'm putting it on the table for you to respond.
And I mean, I welcome the suggestion, but I just want to extend also, and it's just thinking aloud. I'm the chairman of the Infrastructure Committee of Parliament.
Great.
And, you know, one of my mandates when I took on the responsibility to be chairman is saying that we don't want to just examine ongoing projects, but we want to look at policy papers going forward in how we can improve just government's work and delivery to the general public. So now we're looking at a policy paper on the construction industry. But I would love to look at, because one of the things that I'm getting from the yesterday and today is that in many instances, when we are building out our infrastructure, it is evident that we're not looking at the safety one. Not only, well, we look at what is safety for the driving public, but not for the pedestrians and other users of our roadways. So it is something that I would love to have that discussion on within the Parliament itself in that committee. So, you know, I'm extending that invitation that we can look at a policy paper somewhat, or if there is a policy that the road safety unit has.
Road Safety Council.
Our council and the unit within the ministry itself, so that we can start that public discussion on it and seeing how best we can bring it within the policies of our different legislation that govern road construction.
Sure, sure. So we have that's a yes. Okay, thank you very much. During the discussion, well, towards the end of the discussion, Paris was saying to me that a lot of the work which Julio is talking about has been done in Jamaica by Paris, and except for the star rating that he hasn't done yet. So going forward, we're going to involve Paris a lot more in the discussions, because we have done some tremendous work here in Paris, but Paris doesn't want to work in Jamaica. He has an international reach. He works in the Caribbean, and he also has done some work as a fellow in the United States. Having said that, we're now going to invite Dr. Michelle Harris, who is the PAHO WHO. We're going to just put back lunch for 10, 15 minutes and invite Dr. Michelle Harris, who has to leave, to present her paper before lunch. Michelle?
Thank you very much, Dr. Jones, and good afternoon, everyone. I want to thank you for giving me the opportunity to speak now before we go to lunch. And if you may note, my presentation, as we were advised, should be on infrastructure and vulnerable road users, but clearly that was addressed already. So it just fits that as a public health person, I'm a public health physician, and we rise to challenges, we rise to the occasion. And based on what we have been discussing here today, no, I wouldn't get into the presentation. I'll just share a few thoughts with you. And in health, we look at prevention, and we look at managing, and we look at cure, because we have to address all across the board. And it's very interesting that the thread of the last discussion looked at getting the policymakers moving and re-engaged and being anticipatory. So in public health, we talk about prevention in different levels. Traditionally, we spoke about primary, secondary, and tertiary prevention. But more recently, what has come to the fore is what we refer to as primordial prevention. And what is that? That is where we put the systems in place, the policies, the infrastructure, in an anticipatory manner, even before we deal with the issues at hand. Those of who have been exposed to the public health paradigm, we know we talk about primary, that's when you catch persons before you're sick, so your health promotion, you encourage them. And so primary prevention, you address before someone gets sick. Secondary, it's early detection, so you do your screening. Think about it. So, and then tertiary is after the fact, where you go back and fix your roads or you fix your infrastructure. And we are able to utilize this paradigm in whatever situation we are faced with. So I say all of that because I particularly like the way we're going when we're talking. And so if we were to put a name to it, is that we're looking at the primordial prevention. What are the systems we're going to put in place before the fact? Yes? And I thank Dr. Jones for throwing out that challenge to our MP. And yes, he's in opposition now, so he has the time to do these things. All right, so that's the first thing. The second thing I'll talk about is that traditionally people think of public health as people who clean up the environment, get the garbage clean, empty the containers so you don't grow mosquitoes for Zika. All of that is good. But when we think about the environment, we can also think about the environment in which we operate. As you can see there, I am the advisor on non-communicable diseases and mental health. Yes, I'm not the PWR, I'm not the PAHO representative. That would be Dr. Jack. Some of you would know that very well. I'm the advisor in non-communicable diseases and mental health. And when we speak about the environment, it is important that we look not only at the subjects of our attention, but we look also at the environment in which they operate. And what is very topical among us right now is the epidemic of non-communicable diseases. And we're starting with the obesogenic environment that we encounter, that our children are encountering. And we're looking not only at focusing on the children, saying to them, don't do this, or don't eat that, or get more exercise. We're also looking at the environment around them. Yes? So we have been in recent times looking at the legislation that either supports or makes it easier for persons to undertake these unhealthy behaviors. So we're not going to be focusing only on the person, the individual, but the environment in which they operate. And it's the same here. Elaine said it very nicely this morning. Are we going to tell the children, will she wind down her window and speak to the children? Or as she said, she'll step back. They're young, they'll soon get it. But will we focus on the children only, or are we going to fix the environment in which we work? So Julio just mentioned the roads. And yes, we need to have better roads. And so we look at what is feasible within our situation. I don't want to say environment again. Well, we can look at what is feasible. Are we going to stretch for the 5-star roads, or are we going to use what works, get to the 3-star road, because it already has an impact and is able to reduce the burden? I just wanted to point out one or two things from my presentation. Am I the one to move it forward, or? Okay, good. No, this is not this? Okay. Oh. All right. Let's just talk about quickly. I'm sure that this must have been presented before, and that would have been the road traffic deaths across globally and by region. Let me just move it along. Oh. So this would be redundant, so I won't go into that. Well, you see here, I'm sure this must have been presented before, that this is an estimated road traffic death rates in the region of the Americas, and the latest data that was available to me was a 2015 publication, which reported on the 2013 data. And we see where the regional rate is 15.9 per 100,000, and Jamaica is below the regional rate. We see a number of other countries mentioned there, but it's important that we see, okay, it ranges from as low as 6 per 100,000 for Canada to as high as 29.3 for the Dominican Republic. And I point this out because we have to be careful when we're looking at our data and at our information, because when we will report that the region is at 15.9, you have those that are above and those that are below. So some of this gets masked in what we are doing. And the same can apply for the Jamaica situation. I saw Dr. Paris-Leo being able to identify exactly which road is the road that has the challenges. So while we have to be careful when we are doing our assessments, when we look globally and when we look specifically at where the issues are, so that we can do, as Julio pointed out, the targeted interventions. We noted, and I'm sure this must have been said before, that the global population increased by 4% between 2010 and 2013. as well as there was increase in motorization. More motor vehicles were put on the road. However, there's been a plateauing of the total number of deaths. What does that mean? Some of the interventions that we have put in place in the past have worked. Yes? And we need to look at that. Once again, we cannot be all enthused by the fact that there is a plateauing of the total number of deaths, because in our region, there was a 5% increase in motorcycle deaths. I wanted to take a look at, so now I'm not knowing how to operate this thing. Okay. If you look here, we need to look at our data, how we collect the data, and the quality of the data. We see where it is reported that in the region of the Americas, 3% of deaths were to cyclists, 22% to pedestrians, and 20% to the motorcyclists. This is, yeah. However, there's a significant grouping that is other and unspecified, 21%. So that speaks to the quality of our data, the completeness of our data collection, and it's something we can improve, or we need to improve as we move along. Pardon me, I don't quite get the direction right. Okay. So the first one was for the region of the Americas. This slide now disaggregates the data by sub-region in the Americas. And the one that is of particular importance, interest to us, I would expect, is the, I have a pointer there. So, is this it? It was working a while ago. Yes, the non-Latin Caribbean. Say again? On this one? No. Thank you, sir. The non-Latin Caribbean. Come on. Yeah. The non-Latin Caribbean. So I just wanted to make the point that for cyclists, globally, it's 3%. The non-Latin Caribbean, it is, which one is cyclist? Green. It is 6.9%. And for Jamaica, it's 8%. Yes? So that's one point I want to make. The next one with respect to motorcycles. Motorcycles would be this, the gray. Globally, it's 2% of the deaths. In the non-Latin Caribbean, it is 17.6%. And in Jamaica, it's 21%. So when we speak about the globally, it's only a 2% involved in motorcycle deaths. For Jamaica, it's as high as 21%. And I think I have that in the other slide. Yes? Right. And the last one, because when we think of the vulnerable populations, we think about the cyclists, the pedestrians, and the motorcyclists. So the last one I'll refer to would be the pedestrians. And we see where globally it's at 22%. For non-Latin Caribbean, it's 28.6%. That would have been in the graph that just went by. And in this one, we see for pedestrians, it's 29%. So again, data. And that's what we do in public health. We look at data, we understand data. Oh, and the last thing I wanted to say is that this here, which is data received from the Jamaica Constabulary Force, we don't see any others. So I think it means that our data quality is a little better than the rest. At least that is how it is represented here. Pointing out, however, that we have two categories that I didn't see in the others, and that would be heavy trucks and passenger buses. Somebody spoke about the taxi men and the bus drivers being involved in incidences. We see the drivers and passenger buses, 8% of our deaths by that road user category. And heavy trucks, I have heavy trucks somewhere. Heavy trucks, 2%. Okay, so those are some of the things I wanted to point out from my presentation. And the last thing I'll say before I wrap up is, because most of this was addressed already, I know you would have spoken about the Sustainable Development Goals. Oh, and the point was made that for road safety to be addressed in 2 of the Sustainable Development Goals is no easy feat. Yes, it means that efforts are being made to give some attention to the burden of road safety. And we know that the goal is to halve the road traffic deaths and injuries, mind you, because we speak about a large number of deaths, but we have another 50 million injuries annually, yes? And to provide a sustainable transportation system for all. And yes, I wanted to take us to this. So protecting vulnerable road users, the Safe Life Package. This is a publication from the World Health Organization that has been published just this year, 2017, which seeks to amass the evidence that we have so that when we are going to be putting out our discussions, we use sound evidence to say what works, what doesn't work, etc. And I smiled when I saw what Julio had earlier, because the 6 areas, and if you can work with me, save lives, S for speed management, L for leadership on road safety, I for infrastructure design and improvement, V for vehicle safety standards, E for enforcement of traffic laws, and S for survival after a crash. And you know the survival varies depending on what are our facilities available, even from the way we move persons around. In your study that you presented just last week, we saw an interesting ambulance that moved the persons. The ambulance has a red plate. It's really just a taxi. That's what we move our people around with. Yes? Even from the moving of our persons involved in crashes can affect the survival rate, where in the country they're affected, how quickly they can get to a trauma center, all of those things. So this package, the Safe Life Package, that has recently been published by the World Health Organization, seeks to identify some of the evidence. And I know that someone would have dealt with infrastructure before. We've spent quite a bit of time this morning speaking about enforcement, the vehicle safety standards, etc. So I won't go much further into that. So I will stop here, and I thank you for your attention. But in closing, I'd just like to say that a number of issues, anything that affects the health and well-being of the population, is of interest to us in public health. Thank you very much.
It seems our chairperson is on a radio interview, so we'll cheer ourselves in the meantime. Lunch? Okay.